everyone, my name is Dr. Amna Husain, board certified pediatrician, board certified lactation consultant, and mom. Today we're going to discuss some of the most commonly heard sleep myths and bust them. Maybe there's truth to them, maybe there's not. Let's get started. Alright, so first off, let's talk about the most common myth that I am so tired of hearing as a pediatrician: not to wake a sleeping baby. This is completely false, and I'll tell you why. When your baby is initially born, they do lose some amount of weight. There's some fluid shifts, and this is something that we know as pediatricians to watch and track. It's not your fault as a parent. It has nothing to do with your milk coming in. If you're a first-time mom or even a second-time mom, this is just something normal. But we want to make sure that we don't lose too much birth weight and get into potentially a dehydrated baby. So yes, that means waking up your baby regularly to feed in the first couple of days until your pediatrician says, yes, they have regained birth weight. Now, I can't provide personal medical advice for you here. I am not your child's pediatrician, but this is something that I commonly see in my patients, that you will have to absolutely wake your baby initially. So if your baby is giving you longer stretches, yes, in the first few days when you come home from your hospital or your birthing center, you will want to wake them at least every 2 to 3 hours, even overnight. And then the goal will eventually be that you are waking your baby during the day so that they are not waking you at night, because you want to try to get those calories and those feeds in during the day when their circadian rhythm is hopefully regulating, that's when they are supposed to eat, and then overnight they will give you longer and longer stretches because they got those feeds in. So hopefully that makes a little sense, but I am a big advocate of, yes, absolutely waking the sleeping baby when it is important to do so. On that note, when it comes to waking a baby and training a baby, this word can be very triggering. So a lot of parents are under the assumption that they need to sleep train. You don't necessarily need to sleep train. You really don't. In fact, the word sleep training can be very triggering, just like potty training can be very triggering for some. You are teaching your child a skill set though. So you can call it self-soothing or self-settling, whatever you want to call it. I think that is really helpful because you do want your child to learn this independent skill. You don't necessarily have to use the word train if, again, it can be triggering for you and cause a lot of anxiety. But I do think you don't necessarily have to close a door and put your child down and let them cry it out. Whatever you want to do, if that sleep method is working for you in a safe way, so that means it follows SIDS practices, or SIDS prevention practices rather, making sure it's in their own space, whether that be a crib or a bassinet, with a fitted sheet, no fluffy blankets, no stuffed animals, making sure that they are not necessarily in the same bed with you, but they are in the same room so you can attend to them. I think that's totally fine. You're doing it from a safety standpoint, but also being able to attend to them as needed. And if you're not ready to sleep train, you don't have to. So this myth out there that you need to sleep train your baby isn't necessarily something that I really agree with. I do think it is helpful though to start teaching some self-soothing and self-settling skills. So maybe that means you are putting your baby down drowsy but awake so that they are realizing that they're falling asleep in that crib or bassinet and not in mom or dad's arms each time. Okay, so on that note, another myth I commonly hear and things that parents always ask me about is, does my child need a bassinet? No, not really. There's no reason that your child necessarily needs a bassinet. A lot of parents might prefer it for a couple of reasons. The bassinet takes up a lot less space than a crib, and generally a baby looks a little bit more cozy, comfy, cuddly in a bassinet because it is a little smaller compared to a larger crib. However, I'll give you two perspectives. From my standpoint, when I had my first daughter, we lived in an apartment. I didn't have room to have tons of different things. I had one stroller and I had one sleep aperture, which you could say I chose a crib over a bassinet because I knew the crib would go a lot further for us. So in general, yes, she did look very small in the crib. But there's no reason that you necessarily have to use a bassinet. And on that note, there's no reason you have to go out and buy a fancy bassinet. You just want your child, again, to be using the best and safest sleep practices that work for preventing SIDS, but also allow them a consistent place to sleep. So for us, that was a crib for both my daughters. Now, as they got older and they moved to, let's say, their own room out of our bedroom, then they were still sleeping in that same crib, so they actually got a little bit of familiarity to carry with them into their own room. Last myth, your child will let you know when it's time for them to go to sleep. I think this one has like a little bit of grayness to it. Yes, your child can absolutely give you sleepiness cues, which I am a huge fan of, and I think you should absolutely learn your child's sleepiness cues, because that's when you can pick up on that amazing really sleep and wake window and be able to put them down when they need to be put down. However, some children will also need you to give them the setup so that they know that it's okay to go to sleep. And that means you need to establish a consistent routine. So for example, if you're feeding your little one, maybe you unswaddle them, feed them, and then you have a routine after that, whether it be tummy time, or if your child's feeding solids, you could offer them solids, or play time, whatever it may be, book time, reading time. Then they know when it's time to go to sleep, you do the same practices. You bring them up to their room, or you wrap them up if you're swaddling them, or you're able to put them down. They have the same white noise machine on, whatever that may be. So some consistent routine. When it comes to sleep time in the evenings, I think this is a great tactic, because you're really setting them up for success. Let's say it's bath time, bottle or breast, and then maybe reading them a book. Right now you can buy my book, It's Time to Say Goodnight, a children's bedtime story, in the link below in the show notes. Once you buy it, make sure you DM me a receipt of the purchase, and you'll be entered to win a free sleep consultation with me. But in general, you can absolutely set yourself up for success if you just start establishing a good routine early on. So yes, a child will let you know when it's time for them to go to sleep, but you also have to give them the right tools and establish the right background. So I hope this video was helpful. Make sure you hit subscribe below, because we're going to be discussing a lot more sleep content in the coming videos. See you next week. Bye.